Really, the idea that we had of building this is to have the care that you would get at some of these bigger name hospitals and bring it to people here at Garfield Medical Center. When I come here, I know my patients are taken care of, their needs are met. It really makes my job easier.
Please help me understand what the fatty liver is all about, why it's important for this particular community, and how house medicine and Garfield Medical Center are helping patients.
Yeah, so fatty liver, it's becoming more and more important as a cause of liver dysfunction and liver disease. In the last several years, it has become the most common indication for liver transplant. And not only that, it's becoming a very common cause of liver cancer. And especially in the Asian population, it is very, very common due to genetic differences to deposit more fat in your liver. So that combined with, especially if you're not born in the United States, if you're born in an area that has hepatitis B that's endemic, combining those two things together can really lead to early onset of liver problems. So it is very important to get tested for these things, not when you're older, but actually when you're younger, so you can prevent these things from happening.
And again, I'm learning about this idea of house medicine coming into Garfield Medical Center for the first time. How important is it for you as a surgical oncologist to work with the same team here in Garfield Medical Center?
It is of utmost importance. Really, the idea that we had of building this is to have tertiary care, the care that you would get at some of these bigger name hospitals, and bring it to people here at Garfield Medical Center. I have patients come to me all the time and say, oh, I have an appointment with this big time surgeon with a big name.
Right.
And you might see that surgeon in their office.
Exactly.
They might do your surgery.
Right.
They aren't going to be in your bedside every day like I am going to be,
yeah.
and my team's going to be. And I can tell you how important it is for me that when I come here, I know my patients are taken care of, their needs are met. It really makes my job easier.
There's an old saying, don't judge a book by its cover. Maybe I could say, don't judge a hospital by its outward appearance. It might look big, but what comes down to is the team that's there doing the surgery.
There's no doubt about that. The most important thing is that you have a team that is going to be there for you, is knowledgeable, responsive, and that you feel comfortable with. And that's the most important thing. And I can guarantee you that here at Garfield and with house medicine there, we have that.